Hi, my name's Gill and I'm a hygienist at Elmsleigh House Dental Clinic. We all know how important it is to keep our teeth and gums healthy, so today I'm going to demonstrate good techniques to do this thoroughly. For demonstration purposes, this patient hasn't cleaned half of her teeth for a few days, so I'm going to use disclosing solution to show up any plaque that's left behind. And then I'm going to show you how to clean the teeth thoroughly to remove the plaque. As you can see, after disclosing, the plaque that's been building up on the patient's teeth for a few days has been dyed purple colour, and this side is nice and clean. And now I'm going to demonstrate how to remove this plaque using good toothbrushing technique, interdental brushes and dental floss. So I'm going to use an orange interdental brush first. I'm just starting in the middle, gently guide the interdental brush in between the teeth, like so. And once you're in there, just in and out a few times, just cleaning against the side of each tooth and out, and then move on to the next one. Guide it in gently and then in and out. This space is a little bit bigger, so you do need to use a slightly bigger interdental brush. So I'm going to use a red one here. It's important to use the right size brush to fit the gap. If it's too small, it's not going to do much. And on to the next one. You might notice some bleeding in the patient's gums. This is because the plaque build-up has caused some gum disease. So don't worry about any bleeding. It's just a sign that you need to clean more with the TPs. And within a few days of regular use of these interdental brushes, the bleeding will stop. To do the back teeth, just bend the brush over, and if you close your mouth halfway, it just allows for better access into the back teeth. I'm going to demonstrate how to use an electric toothbrush. So get it at the back of the mouth. It's best to start at the back and work your way around the teeth in order, so as you know you're going to get absolutely every tooth surface, and get the toothbrush at a 90-degree angle on the side of the tooth. Switch it on and stay on that tooth. Just work it into the tooth and right up next to the gums as well, just pulsing it in slightly, just for about 5 or 6 seconds, and then move on to the next tooth. Again, 90-degree angle, just press it in like so. And then on to the next one. Just pushing in so as the bristles are sliding up the tooth and getting up underneath the gums as well. Like so. And just pulsating it in. When you're doing the bottom teeth, it's a slightly different angle than on the top teeth. On the top teeth, it's straight on the tooth. On the bottom teeth, it's approximately 45-degree angle, just down towards the gum line. Switch the brush on and again just gently massage in down towards the gums, one tooth at a time, and working your way around. The inside of the bottom molar teeth are quite often an area that gets missed when you're brushing, so you've got to really twist your hand in to get in around the gum line on the inside of the bottom right. Really get the toothbrush down in towards the gums, and gentle circular motion. I recommend electric toothbrushes, but if you don't have one, I'm going to demonstrate how to use a manual toothbrush. Same principle applies, just straight on the teeth and going around tooth by tooth, just gently pressing on the toothbrush so as the bristles get up next to the gum line, and gentle circular movements, flicking down away from the gum. Flick down. On the bottom teeth, again, like with the electric toothbrush, it's at a slight angle, about 45-degree angle down towards the gum line. And gentle circular movements and flick up away from the gum. Don't scrub, this can cause gum recession. To start flossing, just anchor the floss on one finger, middle finger, and the middle finger of the other hand, just wind most of the floss, leaving a few inches in between. Then with your forefinger and thumb, just hold the floss like that and use only about a centimetre of floss in between your thumbs to floss with. I'm just going to get the floss in between your teeth, going gently at first, just to get past this contact point. And what you do is curve it around the tooth and just gently slide it down the tooth. It will disappear underneath the gum a little bit, and we floss up and down the side of one tooth, then move the floss across to the other side and gently floss up and down the side like that. Don't go straight down the middle because you'll end up cutting into the gum and that can end up doing more damage. So gently up and down on one side and across to the other and out, and repeat the same thing as you go along, so up and down. Most people do find flossing their teeth quite difficult, and if done incorrectly can actually cause more damage. So that's why some people do prefer to use the interdental brushes, which can be more effective.